Welcome to Health Simplified, brought to you by Sentara Health Plans, where we improve health every day. I'm your host, Zenola Smith. No matter who you are or where you are on your health journey, this podcast is designed with you in mind. We're giving you simple answers to big questions surrounding health. No big words, no fluff, just facts. If you're a parent, teacher, or anyone who dreads the sniffles and sneezes when fall rolls around, this episode is for you. As kids head back to school, the season for colds, flu, and RSV kicks into high gear. So how can you protect yourself and your family? What's the real difference between these viruses? And when should you ride it out at home versus calling the doctor or going to urgent care? We know it can be confusing to tell these viruses apart, figure out what's best for your family, but we have the answers. Our guest, health educator Dani Hill from Sentara Health Plans, is here to help us break it all down and share what you really need to know this season. Thank you so much for joining us today, Dani. We're so glad to have you. Before we get started into today's episode, can you tell us about what made you get into this field of work and just a little bit about yourself?
Sure. So I'm actually a Hampton Roads native. I've lived here my whole life. And my mom was actually a surgical assistant at Norfolk General Hospital in the operating room for about 30 years. So way back when, I was able to go and watch surgeries as a kid, and it really inspired this love of anatomy and physiology for me. So as an athlete growing up, I kind of saw the benefits of being physically active and keeping yourself in a good health state. So having a good diet, getting good sleep, and that really inspired me to want to continue that when I started working. So I'm a health educator for Sentara Health Plans, and our department is the Health and Prevention Department. What we do as a big group of nurses and health educators, we have registered dietitians on our team and a lot of really great support positions as well. We develop education around what you can do to prevent or reduce your risk for different types of chronic diseases or things like the flu. So our team will go out and we can do health screenings to help educate people on how they're doing in terms of some of their health state, like their cholesterol, their blood pressure, their A1C, but we also do flu vaccination clinics. So we go out into the community all throughout the state of Virginia and other parts of northern North Carolina, and we do flu vaccination clinics and can help people to get ready for cold and flu season.
Wow, so not only are you preventative, you also educate people and help with the flu vaccines. And that's pretty much why we have you here today, because you know what you're talking about when it comes to the cold, the flu, and RSV. So thank you so much for being here today. With back to school season about to start, we're about to get back into school. And I know with going back to school, there can be germs and things of that nature. Can you just dispel some of the myths that we hear when it comes to the cold, the flu, and RSV?
Yeah, so actually the cold, flu, and RSV are all viruses. I think the biggest myth about that is that you can take something to get over a virus. And there's certainly things that can help you with your symptoms, but viruses kind of have to run their course in the body. So a lot of times, especially this time of year, people want to know, how do I prevent my kids from getting sick, right, at the beginning of the school year? How do I prevent it from spreading to the rest of the family? And if we get one of these viruses, what can we do to just get over it quickly and as easily as possible?
Yes, that is definitely true. I know a lot of people are probably very scared of going back to school because of all the viruses. Would you say that when you first get back to school during the cold season, that's when the flu and RSV and colds are more prevalent?
They do tick up around the time that school starts, but you can get a virus any time of the year. There's a couple of reasons that we have a cold and flu season, and RSV falls into that same category. So usually any time between September through March is when we'll find that people are getting those types of viruses more frequently. The main reason I think most of us have probably seen this is that it's cold outside. So you want to be indoors. So we're sharing more indoor space. We're usually closer to other individuals. And those types of germs that make up different types of viruses, they can live on surfaces. So if we're inside, we're probably touching doorknobs or light switches or remote controls or whatever more often. So that's part one. The other reason is that viruses actually really like cold, dry weather. They do better in those types of environments. So there's actually this coating on the outside of a virus that hardens and becomes more stable in cold weather. And with the air being dry, those particles, those germs, they can travel farther. And so it makes it easier for us to contract those types of viruses when it's cold outside.
You definitely just opened up my eyes a lot because I always assume that colds brew in the heat. And like if I'm in a crowded place or anything like that, I'm like, oh, I'm going to get a cold because germs are just everywhere. I did not know or realize that they actually brew when it's colder outside.
They do a better job. They will, the fancy term is proliferate. So they just can survive better. It's just better conditions for them, and it makes it easier for them to get into our body.
Mind-blowing for me. I'm pretty sure there's probably somebody else out there who's like, I did not know that either. So thank you so much for, I guess, dispelling the myth there. I don't know who else thought that, colds brew in the warmth and everything like that. So I know it's getting cold outside. And previously you talked about how the cold, the flu, and RSV are all viruses. Can you tell us the difference between the three, or is there a difference at all?
There's not much of a difference. They are all viruses, which we've already talked about, and they're all respiratory viruses. So what that means is when a virus attacks our body, it takes over our cells. So the virus doesn't have the ability to kind of live on its own. It needs a host. And so it uses our cells and damages those cells. And that's why as you have a virus, typically you'll notice that your symptoms start kind of mild and then they'll grow. And that's because the virus is growing. It's taking over more cells in the body. Respiratory viruses tend to isolate, or they tend to kind of only attack cells within our respiratory system, which is the organs and tissue that we use to breathe. So that's why most of the time with cold, flu, RSV, there's a few other respiratory viruses, most of our symptoms exist from our chest up. Sometimes you can see some symptoms lower, especially with the flu. You might get some upset stomach, diarrhea, vomiting. But most of the time, we have symptoms that are in our chest and above because that's where those viruses like to attack our cells.
Well, and is that something that we can treat at home, or should we always go to the hospital or ER? When should we seek help for treatment?
That's a great question. So there's really not medicine to help a virus move along faster. There's different ways that we can aid it. We can definitely treat the symptoms. There's some things that you can have done through your doctor, through hospital if you're in a really, really bad state. That can help to aid in the process of getting over a virus. But our body's got to do its work to fight that virus off. And that's why we have an immune system. There's things that we can do to help our immune system, but that's really, we have to let it run its course. That's different than a bacterial infection. So if you have an ear infection, for example, you can get a viral ear infection, but a bacterial ear infection is more common. Bacteria can live on its own. It doesn't need a host. So it just needs a good environment. And that's why we can treat those with medicine a lot faster than we can with a virus.
Thank you for telling us like when to seek help and everything like that, because I think oftentimes we're like, let's rush to the doctor, let's do this. And then the doctor sometimes they might say, hey, just rest, hydrate, and keep it moving that way. Do you think that those are some of the tips that we can tell people to just rest and hydrate, or just go straight to the doctor?
Yeah, I think especially with the cold and RSV, they actually present very similar symptoms. So they're relatively mild. Now, the RSV can be more concerning for certain groups of people, young children, older adults. If you're immunocompromised, meaning that your immune system's not going to work as well as it would otherwise. If you're in one of those types of categories, you certainly can have more severe symptoms with RSV. But for the most part, cold and RSV are about the same. You're going to feel kind of tired. You might have a low-grade fever, congestion, maybe coughing. But most of the time, you're going to feel better in a couple of days. The flu is a little bit different. You can have the same exact symptoms with the flu. So you may be walking around with the flu and think that you just have a cold. But there are some trademark symptoms that come along with the flu, like that high fever, chills, body aches, still feeling tired, but sometimes the tired is really you're just struggling to get off the sofa.
Yeah.
And then you can have those lower GI things that we have already talked about. So you might get some diarrhea, upset stomach, vomiting, like that with the flu. But any of those viruses, most of the time, they're going to take care of themselves. We need to treat the symptoms so we're comfortable and we're letting our body rest as much as we can so that it can do the job of letting our immune system respond to it.
It sounds like our body is a fighting machine, and we just need to let it run its course. And I'm glad that you brought up the specific populations of like pediatrics and then also older adults. So when I think about pediatrics, younger children who are unable to communicate their feelings and how sick they feel, and also about to become a new mom myself, I just see myself rushing to the doctor all the time. What is a good boundary if a child comes across these symptoms and they're unable to communicate how they're feeling?
Right. That's a really great way to frame that question because certainly you've got not just kids, but different populations of people for different reasons that may have a hard time communicating how they're feeling. So the best thing that you can do is really monitor your symptoms. So if you kind of notice you're not feeling good, or maybe your child's not feeling that great, they're running a fever, they're congested, maybe if you have a baby, they're not drinking as much milk or eating if it's a toddler, you definitely want to keep up with those symptoms and make sure you're watching. Are they getting worse? How long are these symptoms going on? Things like that might warrant you reaching out to your pediatrician or going to urgent care or something like that. But if you run into a situation with any of these types of viruses where you have a very high fever, if you are lethargic, meaning you're having a hard time responding, you're very, very tired, if you're not hydrating. So, most of us, if we know how to use the restroom, we know whether or not we're hydrated or not. You can always look at the color of your urine to tell whether or not you're hydrated. If it looks like lemonade, you're good to go. If it looks like apple juice, you need to go ahead and drink some water. But with babies, if they are not wetting their diaper as much as they normally would, that's a sign that they may have some dehydration going on. So those are good ways to determine it might be time to call the pediatrician. If it's after hours, most pediatricians' office have an after hours number that you can call. And I know here at Sentara, we have our after hours nurse advice line that you can call. I'm sure many insurance companies have something similar to that you can call and speak with someone and see, is it at the point that I need to either schedule a next day appointment or do I need to act now and go to the emergency room or to urgent care?
I think that will provide everyone, including myself, with a lot of peace. Like, hey, we probably don't need to rush and sit in the ER for a few hours. We can call first and see where we need to go from there. So I know when we get into back to school, and we talked about that earlier, going back to school and the cold months and the flu and everything like that, generally it's focused on children. So I kind of want to dive into children just a little bit. For new parents specifically, what should they watch out for when it comes to the cold, flu, and RSV?
Really, those symptoms that we've already talked about are going to be the big key indicators of what they need to do, right? So if you have a child that's congested and they maybe have a cough and they seem a little tired and not very comfortable, maybe a low-grade fever, that's probably okay for you to monitor at home. But if you are noticing, again, they're not hydrating, they seem very, very tired, very almost unresponsive. If you notice that the fever is spiking, it's getting quite high. And then specifically with RSV, sometimes you can notice a wheezing sound, especially when you exhale. It might sound almost like a little whistle. If that turns into something where they're having a harder time breathing, rapid breathing, a really severe cough, it seems like they can't catch their breath, those are also indications that you might want to reach out to someone for care. There's another symptom that you can see with RSV, and it's actually a blue tinge to the skin, and it just means that we're not taking in enough oxygen. So if you notice a blue kind of color, especially around the lips or in the nail beds, that can also be an indication that we need to go ahead and take some action. So again, your options could be calling the pediatrician. If it's after hours, you could always call an after-hour line. Certainly the options of urgent care, or something like that. And depending on the type of plan you have, you may be able to also use online virtual care as well. So that could be an option for you. You want to check your coverage to see. All of those are great options. We always are concerned about if you're sick, you don't want to go and sit in a waiting room and then potentially expose yourself to more, especially as a baby or as a newborn or a child. So in those scenarios, look for opportunities where you maybe can do an online check-in and wait in your car. Or again, if you have the option of doing a virtual care option, that might be something worth considering too.
Thank you for bringing up the virtual care option. And I know we have to check our plan, but I know oftentimes parents especially will say, I want the doctor to look at my kid. So that could be an option if it's covered on your plan to figure out what your solutions or resources are to be able to help your child.
Right.
And I know we were talking about all the different viruses, and I'm just curious to see if they can lead to something more severe. I mean, to me, the cold, the flu, and the RSV, they're already severe, but can it lead to something else like pneumonia?
That's a great question. Yes. So you can find folks that have pneumonia. Actually happened to my son a couple of years ago. He had the flu and it developed into pneumonia. So you can have that happen. There's other types of kind of airway constricted complications that can come from especially RSV and those special populations we talked about, and then the flu that can happen with the flu as well. So really monitoring after you feel like you've gotten better. Are you still struggling to catch your breath? Are you finding yourself to run out of energy very quickly? Do you have a cough that's lingering for a long time? Children in particular, they can have a cough that lingers for a while. Their lungs are so small that it takes a lot of effort for them to dispel some of that extra fluid that will result from something like the flu or RSV. So just monitoring those symptoms. And if you notice it's taking a long time to get better, that might be an indication it's worth getting checked out.
And I know you said if it's taken a long time, I don't want to get down to the nitty gritty of time frames, but even for when we talk about children and adults and then our older population, would it be a time frame of, hey, if they're not feeling better in 2 days or a week, should they go back to the doctor and say, hey, I'm taking this, I'm not feeling better, let me go back and seek more help? Is there a specific range? Even though I know you also mentioned that we have to let our body, the virus run its course.
That's a great question. So with something like the cold or you have milder symptoms, you typically will recover faster from something where your symptoms are less severe.
Right.
But if you have a more severe case of the flu or RSV or any type of virus, really, it's going to take longer to heal. Most of us can get over a virus pretty much on our own. We might not feel great for a while, but for the most part, a week or two, and we're okay. After 2 weeks, if you're still having symptoms and you notice that they're not getting better, certainly if they're getting worse, or if you have a scenario where you feel great for a day or two and then those symptoms are coming back and you're almost kind of going back and forth where those symptoms are reoccurring, those are all signs there might either you haven't gotten through that virus all the way and you need to give yourself more rest, or there's something else going on and it might warrant some additional testing or an exam by a healthcare provider.
That's very good that you brought that up as well, because so basically, long story short, do not wait a month to still feel bad. Like you should probably seek help again before a month, maybe 2 weeks tops, if you're not getting better.
That's right.
Yes. Okay, that we can rest assured there. Do not wait a month to get better.
Yeah, that's right.
So I know we've spent a lot of time discussing the children, but I don't think we've talked about school age. And I know that's a different population. So are their symptoms different or anything like that than it would be in a smaller child?
Not that different. The biggest thing that school age kids have going for them is they have an immune system. Right? So babies and toddlers, they are born with an immune system. It just hasn't gathered a lot of information yet because it hasn't been as exposed to things as a child that's already in school. We know that kids, they touch everything, right? Especially preschool age. So they're picking up toys at preschool or at daycare. They're putting their hands in their mouth a lot. They might be sharing drinks or snacks with their classmates. So they're getting exposed to a lot of germs. We get exposed to germs every day. Our immune system is working hard every day to keep us healthy. But babies in particular, they just haven't had that level of exposure. So what we see a lot of times with school-age children are two things. The first is they are better communicators. So they
Yes.
can let us know if they're not feeling very good, and we can treat their symptoms and help them feel comfortable while their body is doing what it needs to do. And then the other component of that is that they've already started getting vaccines. And so since they have a little bit of that extra immune response going on, they typically, or symptoms will be the same, but we can kind of rest a little bit more assured. Still monitoring them, still want to make sure that we're watching their fevers, watching their symptoms, but most of the time they can push through those types of viruses and kind of beat them on their own.
So it's almost safe to say the older you get, the stronger your immune system should be or gets over time. It's where you're able to fight
That's right.
viruses.
That's right. The only things that can impact that are certainly if you have a health condition, if you have any types of health conditions that can impact you, if you're immunocompromised, meaning that you have something going on in the body that's not allowing your immune system to work the way it should. And then if you are on different types of medications, those can impact your immune response as well. So there are certain scenarios that may not be the case, but for the general public, most of us, as we get older, our immune system is just getting smarter, it's learning more, and it can respond to different things that are pathogens or foreign bodies that enter our body. We can respond to those better.
And I know that you brought up something earlier, just briefly, about vaccines. I know it's a hot topic and it's very controversial. However, can you tell us some of the preventative methods for vaccines? Or I know you also specialize, will help with the flu vaccines when you go to the clinics and everything of that nature. Is it recommended to get a flu vaccine to prevent these viruses, or what's really the standard recommendation?
So, American Public Health is going to stand by that vaccines are one of the best ways that you can help your immune system to fight different types of viruses. That's also the stance of Sentara. The way that vaccines work is we're given doses of them as we're kids. You might need boosters of certain types of vaccines as you get older, or if you're pregnant, you might receive some boosters. But then there's also vaccines that are annual, like the flu vaccine. With the flu vaccine, the reason that it's annual is because a lot of data is collected from across the world to understand which strains of the flu virus are likely going to be the most common for that upcoming cold and flu season. And the vaccine is developed to address those specific strains. So that doesn't mean that you get the flu vaccine and then you're not going to get the flu. That's not how that works. But you're giving your body an extra layer of immunity, extra layer of immune response in order to fight that virus if it becomes present in your body.
And if so, I know we have the flu vaccine. What about if we're talking about the common cold or RSV? Is there any type of vaccine or preventative things we can do to protect ourselves?
So the RSV vaccine is available to kids. You can get that into your regular immunization schedule. You can get that from your pediatrician. You can get it from your health plan. It's posted on the CDC's website. So you can kind of see the specific ages that you would get those RSV vaccines. You can also get an RSV vaccine as an elderly person as well. So if you're dealing with certain chronic conditions, it's recommended. And also if you're in an assisted living facility or anything like that, where you're going to be around a lot of other people and you're living in close quarters, it's recommended to get an RSV vaccine as a senior citizen as well, along with some others. The cold does not have a vaccine, and that's just because it is a big group of viruses that kind of are all defined as the cold. So our body usually does a pretty good job on its own of fighting that one off.
That's good to know. At least we have safety precautions, in place. Now I'm going to take a totally different spin on things. Let's say if I'm a person who I don't want to get a vaccine. I don't like vaccines. I don't want to get them. What is something that I could do, I guess, naturally or natural, to prevent myself from coming across the cold, the flu, and RSV?
Yeah, that's a great question. And a lot of this is stuff that is really great to start teaching your kids as young as they, are able to understand this type of direction, because these are habits that you can use throughout your life. that will help to keep your immune system running as best as it possibly can. So the first layer is to wash your hands, right? A really great habit is when you come into your house at the end of the day, if you've been out, whether it's work or school or doing anything else, come inside, immediately washing your hands, and then washing your hands before you're eating or touching your hand, or excuse me, if you're touching your nose, your mouth, your eyes, things like that. So that will really help to kind of keep the level of germs present on your skin low. You can also be mindful of sanitizing and wiping down your surfaces. So using different types of sanitizers, cleaners, you can use natural products if you'd like, but just keeping those surfaces clean. Counters, doorknobs, light switches, anything that everyone in your house is going to be touching on a regular basis is a great thing to do as well.
Okay, Danny. So I know that we've been talking about vaccines and you gave us a little bit of guidance around that. Let's say I'm a person, I'm still at that point where I'm still hesitant and nervous about getting a vaccine. What would you say to me? Are there any myths that you want to dispel when it comes to vaccines?
I don't think there's anything wrong with being hesitant, right? That just means that you are an informed person that's actively involved in your health, which is good. The big thing I think we hear the most at our flu events that our team goes out and does is someone's afraid that the flu vaccine is going to make them feel sick.
Yeah.
There are certainly symptoms that you can get. Your body is being injected with something that's foreign, right? So you're gonna have an immune response. Most of us don't feel anything. You might feel a little tired. You might feel a low-grade fever. That's your immune system kicking in and saying, hey, what's here? Let's check this out and make sure everything's okay. But you could also have some injection site, swelling, tenderness, redness, nothing that should be uncomfortable. If you get to the point that it's uncomfortable, then certainly let that individual, whoever gave you that vaccine know, or you can always, reach out to their office again afterwards or whatever that protocol needs to be for that. Another big myth that we hear a lot is that it's going to give you 100% immunity, and that's not the case either. So it takes about 2 weeks for the vaccine to fully go into effect. So in that window of time, you could still be exposed to the flu. You could still get the flu afterwards. It's just a way to help prepare and prevent the flu from getting worse if you are exposed to it.
So let's say if I want to do research about the vaccine or see if it's even a right fit for me because I am hesitant about it, are there resources that I could use or go to kind of explain to me what I'm getting myself into in a sense?
Sure. So you can always check out the Centers for Disease Control. They do a great job of monitoring all different types of vaccines, and they have a really great information on the history of vaccines and all the safety protocols that go into those. You can also check out the American Academy of Pediatrics. They have really great information on vaccines that you would get as part of your standard vaccination schedule for your children. Certainly ask your doctor or your healthcare provider. They can give you some really great things that you might want to consider in terms of vaccines. At the end of the day, if you decide that vaccines aren't for you, that's okay too. The big thing is just making sure that if you feel sick, to communicate that to those around you and keeping yourself away from others while you're contagious so that we can avoid the spread of flu or cold or RSV or whatever you might be dealing with at the time.
Thank you for telling us where to find reputable sources versus Google. So I think sometimes we're like quick to Google things, but I think if we educate ourselves through reputable sources, we'll be able to solution seek a little bit better and make wise decisions.
Right.
So I know you mentioned a reputable source would be the CDC. What is something, if I'm trying to do research and I come across something that I'm not too sure of, what would be like a red flag for me? That's like, hey, this is not a reputable source. We might just want to stick with something else.
Yeah, it's hard nowadays. I mean, we're online for everything and we're getting information fed to us through a multitude of channels. So it can be hard to tell what is the right information and maybe what is not. Always check to see how out of date the information that you're receiving is. So most websites, especially if they're reputable, will cite their sources at the bottom and or give you a date or the last date that web page was reviewed. So if you're looking at something that's maybe older than 5 years, a lot can change in that time frame. So it might be worth, checking out there too. Most of the time, if you're going on to a university website, a .edu, a .org, a .gov, typically those types of websites are going to give you some at least good starting points, but still you want to do your due diligence. So if you are reading through things and you find some questions that you just can't seem to get a good answer to, or the answers don't seem like they're fully explaining what you're hoping to understand, take those additional questions back to your doctor. At the end of the day, that's going to be the most trusted conversation that's specific to you and whatever your health status.
That is good to know. So just point it back to the doctor. Make sure we're getting our resources from there. That's probably the best trusted source, because with the internet these days, everything looks real, essentially.
Your doctor knows you best, right? They can look back at your health history and understand what's gone on with you over the last 5, 10, 15, 20 years, however long you've been with them. They know what medications might be interacting with different types of other medications that you're taking over the counter or with different vaccinations. So it's important to always ask them at the end of the day.
I think that's a good point that you made about everyone's different, and it's not really like a one size fit all. So we really have to do what's best for us and communicate that with our doctors as well. Are there any on-hand items that you recommend families keep on hand during the cold and flu season?
Yeah, there's a lot of stuff that you can keep at the ready if you can tell someone is getting sick. The biggest thing is keeping them comfortable, right? So you want to have a comfortable place to rest. So whether that's a bedroom or the sofa or whatever, you want to be able to make sure that everyone or that individual has a nice quiet space that they can get as much sleep as they need, that they feel comfortable in. It's not too hot, not too cold. Hydration is very important. So making sure that you have water, you've got your good cup, maybe that's going to hold that ice and keep it cold for a while. If you feel like you're up to eating, having a well-balanced diet, a very colorful diet is a really great way to kind of help your immune system. There's so many good nutrients in our colorful fruits and vegetables that our body can really utilize and that can assist our immune response. So that's very important. If you are considering over-the-counter medications to help ease some of those symptoms, that's okay. Make sure that you're reading the back with the directions. Make sure that you're taking it in the correct dosage. You're giving it to the correct audience. So we don't want to over-medicate a child, for example, by giving them an adult dose of something. And you can always ask your doctor about that as well. Thermometers, stuff like that. It's good to have on hand. Heating pads if you've got body aches or chills. Maybe a heated blanket if you're feeling particularly chilly with the flu. That's always good to have as well. And then in terms of prevention, again, washing your hands is number one. If you can't get close to a sink, let's say you're on the go, keeping hand sanitizer with you is handy. Hand sanitizer does not replace washing your hands. So you can still have some germs that will still exist on the skin. So still being mindful, especially when you're out in public and you're touching a lot of common things, the gas pump, the door, the shopping cart at the grocery store, that kind of stuff. Keep your hands away from your eyes, nose, mouth is going to be a really great way to kind of prevent exposing yourself to too many germs. So those are kind of all good things that you can keep on hand. In terms of for school-aged kids, one of the best things that you can do is when they're on breaks or over the weekend, but particularly like on winter break, when you've got them home for a couple of weeks, wash their jackets, wash their book bags, wash their lunch boxes, that kind of stuff, and take them back to school with fresh, clean stuff. Lots of these types of germs can live on those surfaces. And, we tell our kids all the time, if you're coughing or sneezing, you want to cough or sneeze into the crook of your elbow,
right?
As opposed to your hand, where you're going to use your hand to touch surfaces. But, if they're out on the playground, they're coughing and sneezing into the jacket. So we need to make sure that stuff's getting washed because it doesn't get noticed a lot. So giving yourself some time to do that kind of stuff will be helpful in the long run when you go down not feeling too great with one of these viruses.
I think that's a good tip in itself, like to wash the items that you send them to school with, lunchbox, book bag. Like, I don't think I would have thought of that. So yeah, thank you for bringing that to light, because we are talking about preventative measures to make sure that we're all taken care of before it gets to the point. But even if we do get sick, thank you for bringing in the remedies that we can do at home before going to the doctor if we don't have to go.
Right, exactly.
And there's something I was wondering as we were having our conversation, what groups are at higher risk when it comes to the cold, flu, and RSV?
So all of those kind of special populations that we've talked about throughout the course of our conversation today are going to be those groups that are going to be at higher risk. So babies, kids under age 5, again, because their immune system is just not working at the level that an average adults would. Pregnant women can sometimes find themselves at higher risk. The elderly, because their immune responses are starting to dwindle. They're not at the levels that they were at when they were in their prime adulthood. And then those that have chronic conditions, particularly like lung diseases or lung conditions, heart disease, diabetes, those can always impact our immune system, along with several others that if I listed them all, we would be here all day.
Right.
But those that are immunocompromised, so if you have an autoimmune disorder, that can make it harder for your body to fight viruses like these. And then folks that are on medications. Some types of medications can impact your immune system. So again, at the end of the day, important to talk to your doctor.
And see what their recommendations are.
That's right.
And so let's say if someone gets sick with one of those viruses, when would be a good time to return back to school or return back to work if you're an adult?
So most of the time, fever-free for 24 hours is kind of the standard. Definitely check with your child's school or your place of work because that can vary depending on the environment that you're in. But most of the time, if you've been fever-free for 24 hours, you're in the clear to go back. You're likely not contagious at that point. Now, it's important to remember, if your child breaks their fever at midnight, it's 24 hours is midnight the next day, right? So they're going to have to miss school, even if they're jumping off the walls and they're ready to go back. We want to observe that 24-hour period because that's how we're going to make sure that none of their classmates or the staff and administration in that building are going to also be exposed to the cold and flu.
I like how you said check with the school and work because the guidelines can be different, and also listen to your body because you could be fever-free, I guess, but still kind of feel bad, would you say?
Yes, and it's important to be unmedicated fever-free, right? So we're not taking a fever reducer to bring that body temperature back down. It has to be without any medication on board. Are you truly fever-free for 24 hours?
That's another good point because I think that just when you were talking about it, I'm like, oh, take medication and it will be wiped out, but no medication for the 24 hours and ran back to school or work.
That's right.
Okay, thank you. I know we've covered a lot today through this wonderful conversation, but before I let you go, what are a few pieces of advice that you can give us coming up on this cold, flu, and RSV season? Like your 3 or 4 major takeaways.
The biggest one is wash your hands, right? That's something that we could do all the time, and that will help through life, right, with the amount of germs we're exposed to. Do your research. So if you are on the fence about if you want to vaccinate or not, just make sure that you're reading up, you fully understand all of the sides of this kind of hot topic, and ask your trusted resources. The third thing, and this is kind of just a prevention tip overall, we, especially as parents, grandparents, caregivers, even if it's your niece or nephew or whatever, we really prioritize our children's health. We do not mimic what we want for them a lot of times as adults. So we have a lot more stress in our life than they likely do in most cases, but we will make sure they have a balanced diet and they reduce their screen time and they get a good night's sleep and they stay hydrated and they can talk about their feelings or, all of those types of things. And sometimes as adults, we put ourselves on the back burner. So especially when you're not feeling good, treat yourself like you would treat your child in terms of set yourself up to get the rest and recovery that you need.
Well, I definitely thank you so much. I feel prepared already going into this season and welcoming a little one. I'm not going to freak out and run to the doctor. I will call the hotline. Speaking of resources, are there different, other than getting with my pediatrician, are there different hotlines or anything that I could call? Yeah, I need help or advice.
Absolutely. At the end of the day, especially if you're a Sentara Health Plans member, I'm sure other insurance companies are similar. We have a nurse hotline advice line that you can call. It's open after hours, so you can call into it, ask some questions. I myself, as a member of Sentara Health Plans, have used that hotline before. So they're a really great place to get you started and give you recommendations on what your next step would be. And then if you're looking for more on just prevention in general, how to move your body more, how to create a healthy meal for your family, get better sleep, whatever that is, Sentara Health Plans has a whole section of their website dedicated to that. You don't have to be a member to utilize it. You can be any member of the community. SentaraHealthPlans.com/MyLifeMyPlan. Highly recommend taking a look at that if you're looking at anything related to prevention.
Thank you, Dani. You've helped me out. I know for sure, so I'm pretty sure you've helped everyone out there who is listening to today's podcast. So I definitely appreciate it.
Yeah, thanks for having me.
That's all for today's episodes of Health Simplified. A big thank you to our guest, Dani Hill, for sharing practical and reassuring tips as we head into cold, flu, and RSV season. Good hygiene, a little preparation, and knowing when to reach out to your doctor can make all the difference for you and your family. Remember to always consult with your healthcare provider before taking any action based on the provided information in this podcast. If this conversation was helpful, be sure to like this video, subscribe to our channel, and hit the notification bell so you never miss an episode. And if you know someone who could benefit from this information, share it with them. Stay connected with us on Instagram and Facebook at Sentara Health Plans, and visit SentaraHealthPlans.com to learn more about health, plans, and wellness resources. And visit SentaraHealthPlans.com to learn more about our health plans and wellness resources. Until next time, take care and stay well.